I'm Dr. Emma Victoria, and before we talk about numbers, studies, or prescriptions, I want to talk about you. Because if you're watching this, there's a reason. Maybe you take medication every morning without questioning it anymore. Maybe you trust that if a pill was prescribed, it must be safe. Or maybe deep down, you've felt something isn't right, but you've pushed that feeling aside because you didn't want to sound difficult, anxious, or ungrateful for modern medicine. Let me say this clearly and compassionately. Being careful with your heart is not being difficult. It is being responsible. I have spent years treating older adults who did everything they were told, followed every instruction, never missed a dose, and still ended up with worsening heart function. Not because they were careless, not because they ignored advice, but because one commonly prescribed pill quietly worked against their aging heart instead of protecting it. Here's what makes this so dangerous. The damage doesn't usually happen overnight. It happens slowly, silently. You don't wake up one day feeling like your heart is failing. Instead, you feel more tired than usual. Your legs swell a little by evening. You get short of breath doing things that used to be easy. You blame age, you blame weight, you blame stress. And all the while, your heart is compensating until it can't anymore. Now listen carefully, because this is important. Older hearts are not the same as younger hearts. After 60, the heart muscle stiffens slightly, blood vessels lose elasticity, and the electrical system becomes more sensitive. A medication that was once well tolerated at 45 can behave very differently at 70 or 80. Dosages that were once safe can become excessive. Side effects that were once mild can become dangerous. In my practice, I see this pattern again and again. Patients come in with fatigue, dizziness, irregular heartbeat, or unexplained weakness. Tests reveal reduced cardiac output or rhythm disturbances, and when we carefully review their medications, there it is, the same pill showing up repeatedly, quietly increasing strain on the heart muscle or interfering with normal electrical signaling. This is where I want you to pause for a moment and reflect on your own body. Have you noticed changes that don't quite make sense? Feeling weaker even though nothing else has changed? Needing more rest than you used to? Feeling lightheaded when standing? These are not just aging by default. They are signals, and your heart communicates through symptoms long before it fails. In the next part, I'm going to explain why this specific class of medication becomes risky after a certain age, how it interferes with heart physiology in seniors, and why so many people stay on it far longer than they should without reassessment. And when you understand that mechanism, a lot of things may suddenly make sense for you. One more thing, and this matters deeply to me. If you're comfortable, tell me in the comments what heart-related concern you're personally dealing with or which country you're watching from, so I know who I'm speaking to and what matters most to you. You are not imagining your symptoms. You are not weak for questioning a pill. And you are absolutely right to protect your heart because it has been protecting you your entire life. Now, I want to slow this conversation down because what I'm about to explain is not something you usually hear in a rushed clinic visit or a quick prescription refill. This is about how an aging heart actually works and why certain pills, especially ones that were once considered routine, can quietly push that heart in the wrong direction over time. As we age, the heart does not suddenly become weak. That is a myth, and it's an unfair one. What actually happens is far more subtle and far more important to understand. The heart muscle gradually becomes less flexible. Think of it like a rubber band that has been used thousands of times. It still stretches, it still snaps back, but not with the same ease or speed. At the same time, the arteries stiffen, the valves thicken slightly, and the electrical signals that control rhythm become more sensitive to interference. Now here's where medication enters the story. Many cardiovascular pills were originally designed and tested in middle-aged adults, often between 40 and 60. At that age, the heart can compensate easily. It can speed up when needed, slow down when needed, and adjust pressure rapidly. But after 65 or 70, those compensatory mechanisms are weaker. The margin for error becomes smaller. One of the most overlooked changes in older adults is how blood pressure regulation shifts. The body becomes more dependent on precise balance between heart rate, vessel tone, and blood volume. When a pill disrupts even one of these, Especially chronically, it can create a cascade of problems that are mistaken for normal aging. For example, some pills reduce blood pressure very effectively, but they do so by forcing the heart to work harder in the background. Others blunt the heart's natural ability to respond to physical or emotional stress. Others interfere with electrolyte balance, sodium, potassium, magnesium, which are essential for every heartbeat to fire correctly. And in older adults, even small electrolyte shifts can trigger arrhythmias, weakness, confusion, or falls. This is why I tell my patients, the danger is not always the pill itself. It's the pill without reevaluation. I want you to imagine this scenario because I've seen it too many times. A patient starts a medication at 55. It works well, no side effects. Years pass. The prescription is refilled automatically. The dosage never changes. But the body changes. Kidney function slowly declines. Liver metabolism slows. Muscle mass decreases. Fat distribution shifts. The same dose now circulates longer in the bloodstream, acts more strongly on receptors, and accumulates in tissues in ways it never did before. And yet, no one stops to ask, is this still the right medication for this body today? This is where the heart begins to suffer quietly. One of the earliest signs is reduced cardiac efficiency. The heart still beats, but each beat delivers slightly less blood. The body compensates by increasing heart rate or retaining fluid. That's when ankles swell, breathing feels heavier, and fatigue becomes a constant companion. Many people think, I'm just getting older. But in reality, the heart is being asked to do more work with less flexibility, often because of a medication that was never adjusted for age. Another sign is electrical instability. The heart relies on precise electrical timing. Certain pills can slow conduction too much, while others can irritate the electrical pathways. In older hearts, this can lead to skipped beats, atrial fibrillation, or dangerous pauses. These rhythm issues are not always dramatic. Sometimes they feel like mild dizziness, brief palpitations, or a sense that something is off. These symptoms are often dismissed until a serious event occurs. Here is the part that should concern you the most. Many of these pills are still prescribed because they look good on paper. Blood pressure numbers improve. Heart rate looks controlled. Cholesterol values fall. But the person feels worse. And when the patient says, "Doctor, I feel weaker," they're told, "Your labs are fine." Numbers do not tell the full story of an aging heart. Function does. In the next part, I'm going to talk about the specific warning signs your body gives when a heart-related medication is no longer helping, but quietly harming, and why these signs are often misinterpreted or ignored, especially in seniors who don't want to complain. When you hear these signs, you may recognize yourself or someone you love, and that recognition can be life-changing. If this information resonates with you, write one sentence in the comments telling me your age and whether you're currently taking heart or blood pressure medication, because understanding who is listening helps me protect the people who need this most. I want you to stay with this moment because now we move from physiology into something deeply personal. The signals your body sends when a pill meant to protect your heart starts placing it under silent strain. These signals are often gentle at first. They whisper, and because they don't scream, they are ignored. The first signal is unexplained fatigue that does not improve with rest. This is not the tiredness of a long day. This is a heavy, dragging exhaustion that settles into your chest and limbs. Patients tell me, "Dr. Emma, I wake up tired," or "I feel like my energy drains by noon." What's happening underneath is reduced cardiac output. The heart is pumping, but not efficiently. Oxygen delivery drops just enough that muscles and the brain feel constantly underpowered. The tragedy is that many seniors accept this as normal aging, when in reality it is a warning light. The second signal is subtle breathlessness, not gasping, not dramatic, just a slight hesitation when climbing stairs or walking uphill. Maybe you notice you pause to catch your breath when carrying groceries. This happens because certain pills can increase fluid retention or stiffen the heart's filling phase. Blood backs up slightly into the lungs. The lungs don't fail, but they struggle quietly. This is one of the earliest markers that the heart is being pushed beyond what it can comfortably manage. The third signal is lightheadedness or balance changes, especially when standing up. Older adults often attribute this to dehydration or low blood sugar, but medications that alter blood pressure too aggressively can deprive the brain of adequate blood flow during position changes. I have seen patients fall, fracture hips, and lose independence, not because they were frail, but because their medication caused momentary cerebral underperfusion. A pill did that, not age. Then there is the symptom no one wants to talk about: mental fog. Slower thinking, trouble concentrating, forgetfulness that feels new and unsettling. The brain is exquisitely sensitive to blood flow and oxygen. When the heart cannot maintain consistent delivery, often due to medication-induced rhythm changes or pressure drops, the brain suffers first. This is often misdiagnosed as early cognitive decline, when in truth, it is cardiovascular in origin. Now here is where I need you to listen very carefully. Doctors are trained to treat disease, but older adults live with complex physiology, not isolated conditions. A pill that lowers blood pressure may worsen kidney perfusion. A pill that controls rhythm may weaken heart contraction. A pill that reduces fluid may destabilize electrolytes. Each system is connected. When one is pushed too hard, another pays the price. And seniors especially are polite patients. They do not want to bother their doctor. They minimize symptoms. They say, "I'm fine," when they are not. That politeness can be deadly. I want you to imagine your heart as a lifelong companion. It has beaten over 2 billion times for you. It has adapted to stress, joy, grief, illness, and recovery. It deserves precision care, not autopilot prescriptions. In the next part, I'm going to explain why this particular pill continues to be prescribed despite mounting evidence of risk in older adults, how it slipped into routine use, and what questions you must ask before ever stopping or changing it, because stopping incorrectly can be just as dangerous as staying on it. Before we go there, I want to ask you one thing. Please leave a single comment telling me whether you've noticed fatigue, breathlessness, dizziness, or mental fog recently, because your experience matters more than any statistic. I want to take you deeper now, because the most troubling question is not what this pill does, but why it is still so commonly used in older adults despite the risks. This is where the system, not the patient, quietly fails. Many medications that affect the heart became popular decades ago, at a time when life expectancy was shorter and long-term aging physiology was not fully understood. These drugs were effective at controlling a single measurable variable: blood pressure, heart rate, rhythm, and that success created a sense of safety. Over time, they became familiar, comfortable, automatic. And in medicine, familiarity can sometimes replace vigilance. Another reason is that older adults are often excluded from long-term clinical trials. Frailer patients, those over 75 or 80, or those with multiple conditions are frequently underrepresented. That means we have excellent data on how these pills work in theory, but far less data on how they behave in the real bodies of aging humans over many years. So doctors rely on guidelines that lag behind reality. There is also a powerful psychological factor at play. Once a medication is started for the heart, stopping it feels dangerous. Both doctors and patients fear change. What if the blood pressure spikes? What if the rhythm worsens? These are valid concerns, but what often goes unspoken is the equally serious question: what if staying on it continues to weaken the heart day after day? Here is something I want you to understand clearly. Harm from heart medication in older adults is rarely sudden. It is cumulative. It builds quietly. The body adapts until it cannot. And then one day, a minor illness, a missed meal, a hot day, or a small infection pushes the heart past its limit. That is when hospitalizations happen. That is when people say, "Everything was fine until suddenly it wasn't." I have sat with patients who asked me, "Why didn't anyone warn me?" And the truth is painful. The warning signs were there, but no one connected them to the pill. This does not mean medications are evil. Many are life-saving. But every heart medication must be re-earned over time. What helped you at 60 must be questioned at 70. What was safe at 70 must be reassessed at 80. Aging changes the rules. So what should never be done? Never stop a heart medication abruptly without medical supervision. Sudden withdrawal can cause rebound effects, dangerous spikes in blood pressure, heart rhythm instability, or even heart attacks. The goal is not panic. The goal is informed conversation. You deserve to ask, is this medication still appropriate for my age? Is the dose still right for my kidneys and metabolism? Are my symptoms possibly side effects, not new diseases? Are there safer alternatives or lower doses now? These are not confrontational questions. They are intelligent ones. In the next part, I'm going to talk about what safer management looks like for older hearts, including modern strategies that prioritize heart efficiency, blood flow, and quality of life, not just numbers on a chart, and how many patients feel stronger within weeks when their regimen is finally aligned with their age. If you feel this message speaks to you or someone you love, write one sentence in the comments saying, "I'm listening for my heart," because acknowledging the problem is the first step toward protecting the life inside your chest. I want to speak to you now about what most people don't realize: the alternative strategies that protect your heart while still managing blood pressure and rhythm safely in older adults. This is where knowledge becomes power, because the difference between feeling drained and feeling strong can literally be a single adjustment guided by a physician who understands aging physiology. First, let's talk about personalized assessment. Every heart ages differently. Two 75-year-olds can have completely opposite cardiovascular profiles. One may have stiff arteries and low heart rate, while the other may have flexible vessels but reduced cardiac output. This is why a pill that works well for one patient may harm the other. That's why age-appropriate reassessment every 6 to 12 months is critical, even if your labs look normal. Next is monitoring beyond numbers. Traditional checkups often focus on blood pressure, heart rate, and cholesterol, but your body tells a story that charts alone cannot capture. Fatigue, shortness of breath, mild dizziness, swelling in the ankles, or mental fog are all early indicators that a heart medication may be creating strain. These are signs that the system is being taxed, even if your BP reads 120/70. Listening to your body matters as much as listening to the monitor. Then there is dose optimization. In older adults, sometimes less is more. Lowering the dose slightly or adjusting the timing of a pill can reduce side effects without compromising effectiveness. Your kidneys, liver, and heart handle drugs differently after 65, and small adjustments can prevent fluid retention, arrhythmias, or excessive drops in blood pressure. This is why a heart checkup with dose review is not optional. It's essential. I also want to emphasize supplementary lifestyle strategies. Many seniors underestimate the cumulative power of diet, gentle exercise, and hydration. A nutrient-rich diet that supports heart function, rich in potassium, magnesium, and omega-3s, can reduce reliance on higher doses of medication. Moderate daily movement enhances circulation, maintains vascular elasticity, and keeps the heart muscle strong. Even a short 20-minute walk or chair-based exercises can make a measurable difference. These aren't just recommendations, they are lifelines. And here is the subtle but vital point. Medications alone are not enough. They are a tool, not a guarantee. When combined with lifestyle measures, heart-friendly habits, and regular reassessment, the risk of harm decreases dramatically, and quality of life improves. People often assume taking a pill is all that matters. It isn't. Now, here is the part I want you to feel emotionally. I have had patients, after careful review, reduce or switch a single pill under supervision and report within weeks that they could walk longer, think clearer, and sleep more deeply. It's remarkable what proper alignment between medication, age, and lifestyle can achieve, and it is why understanding these nuances is not optional, it is life-changing. In this section, I also want to highlight the importance of communication with your healthcare provider. Don't wait for annual visits. If you notice any subtle symptoms, even fatigue, ankle swelling, mild dizziness, or new shortness of breath, call your doctor. Describe it in detail. Ask for a full review. This is not complaining. This is protecting your life. And here is the suspenseful point I promised earlier. In the next part, I will reveal the exact class of heart medications that are most frequently linked to harm in older adults, why they are so commonly prescribed despite risks, and the questions you must ask if you are taking them. Understanding this could fundamentally change how you approach your own health. For now, take one small but powerful step. In the comments, tell me one symptom you've noticed in the past month, no matter how minor it seems, because recognizing these signs early gives you control over your heart's future. I'm Dr. Emma Victoria, and now we reach the part that could make the biggest difference in your heart health, the moment where knowledge becomes action. I want to speak plainly because your life and your quality of life matter more than convenience or routine. There is a specific class of pills, commonly prescribed for older adults, that has repeatedly shown the potential to strain the heart silently. These are often prescribed to manage blood pressure, fluid retention, or rhythm irregularities. On paper, they look perfect. They lower numbers, they stabilize labs. But in aging hearts, their effects can accumulate and quietly reduce cardiac efficiency. Here's what is critical. This is not fear-mongering. I am not telling you to stop your medication immediately. That would be dangerous. Abrupt discontinuation can trigger heart rhythm disturbances, spikes in blood pressure, or sudden fluid shifts. The point is awareness. The point is discussion. The point is empowered decision-making with your physician. Let me describe the subtle signs that indicate this pill may no longer be optimal for your heart. Persistent fatigue that doesn't improve with rest. Shortness of breath during activities that were once effortless. Swelling in the ankles or feet by evening, even without salt overload. Mild dizziness or lightheadedness when standing. Mental fog or decreased focus that feels unusual for you. If any of these signs sound familiar, it's not just aging. Your heart is speaking, and you must listen. Now, let me guide you on the safe way forward. Step 1. Schedule a thorough cardiac review with your doctor. Explain every symptom, even the subtle ones. Use a notebook if you need to, so nothing is forgotten. Step 2. Ask for a review of all medications, including dosages, timing, and potential side effects. Discuss alternatives if this pill is found to be riskier than beneficial for your current age and physiology. Step 3. Discuss lifestyle interventions that enhance heart health naturally. Gentle daily exercise tailored to your ability. Heart-healthy diet rich in potassium, magnesium, and omega-3 fatty acids. Adequate hydration and sleep to support circulation. Regular monitoring of blood pressure and heart rate at home to detect subtle changes. When medication is combined with these strategies and personalized adjustments, the difference is remarkable. Patients often report more energy, better sleep, clearer thinking, and improved circulation within weeks. These improvements are not luck. They are the result of aligning treatment with the natural needs of an older heart. Here is the emotional truth I want you to feel. Your heart has been working tirelessly for decades for you. It has powered every morning, every conversation, every step, every laugh. It deserves careful attention, informed choices, and protective measures, not blind compliance. Taking action now is a form of gratitude for the organ that sustains you. Before we close this section, here is the one and only action I want you to take in this part. In the comments, write, "I will protect my heart," to commit to discussing your medication and symptoms with a qualified doctor. Remember, awareness plus action is more powerful than any pill alone. By asking questions, tracking your symptoms, and reviewing your treatment regularly, you are giving yourself the greatest gift: a stronger, healthier heart and more years of vitality. Your heart is listening. Make sure you are too.